Okay, thank you so much for coming. I hope you are comfortable in my chair. As you know, I do special cleanings for people of your persuasion at night for my somewhat inflated fee. However, I think you will find it is worth it. Now, let's take a look at those vampire teeth. All right now, Mr. Acula. That's adorable. Please relax. I'm going to go ahead and lean back your chair now, and we're just going to take a look inside. Ooh, you have got some rather pointy fellas there. So first of all, I'm just going to do a couple of quick things. I'm going to put on my silver, and that is simply because occasionally some of the vampires I work with during a cleaning get a little bloodlust, and that's understandable, and they try to end my life. That's why I wear the silver. If you try to grab me, you will get a very nasty burn. So do try to control yourself. But I also understand it's just part of your nature. Now, looking inside here, and of course, first we're going to take a look at these cuspids. Now, I am seeing that all of your canine teeth and your vampiric teeth look wonderful. Now, if you could, again, please try to control yourself. If you could extend out your vampiric teeth as if you were about to feed. Yes, I know it's a little awkward. Normally it's a bit of a reflex, and so it's hard to do on command. But if you could just think about a juicy neck that is full of gorged blood. Don't reach for me. You're going to get that burn. Very good. There go the teeth. I see they are extending outwards very, very nicely. Okay, and retract. Perfect. What I find is that sometimes some vampires have an issue where their magically augmented vampire teeth will sometimes get stuck in transition. It's not an uncommon occurrence, especially for a vampire of your age. Don't worry, I'm not digging on your age. It's impressive to make it to 6 centuries. However, it is simply a nature of the magic that sometimes they get a little stuck in between. Now, fortunately, that's not happening with you. The reason that I'm telling you this is if it starts to happen, I want you to come and see me as soon as possible. There are things that we can do. It is a little uncomfortable because what we will need to do is to treat the gum with a little bit of garlic. I know that is unpleasant, but this is a medicinal dose of garlic. What it will do is I will place just the perfect tiny amount of garlic using my probe right on the tip of your gums. What will happen, just like as you recoil when garlic is placed before you, this will cause your teeth to extend outwards in a defensive gesture completely. And then we will then administer a dowsing agent. And a dowsing agent is a simple anti-magic formulation. It is essentially a kind of liquid sunlight. Whoa, 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 whoa. Don't worry, it is far too diluted to actually harm you. So I don't want any of my wonderful, wonderful patients turning into dust. What it will do is it will be uncomfortable, a bit like shining a very bright light on a human. What it will do is it will cause your fangs to retract. So what we'll do is cycle through that about 3 or 4 times. It's not pleasant, but I'm just preparing you now. When a vampire gets to your age, between 500 years and a millennium, it eventually will happen. You don't want to get stuck in that state, because if we're halfway out, it's kind of hard to woo the victims if you're talking like this. So just so you know, come and see me if that happens. Let's go ahead and open up wide again. Very good, very good. Now, I'm noticing that you're not flossing. Naughty, naughty. Now, you might say to yourself, I am an immortal vampire. My body is perfection in all ways. I cannot die, and I certainly can't get tooth decay. That is true. You can't. But what you can get is blood. You can get little clots of blood stuck between your teeth. And that's a problem. Why? Because blood does exactly what every other bit of organic matter does. It begins to decay, as the bacteria that live inside your mouth will consume the blood. It will give you halitosis. In other words, bad breath. Now you can imagine if you come up to a nubile young woman and say, hello, I am Dr. Acula. And she goes, ew, gross, go away. That's going to put a bit of a crimp in your predatory lifestyle. So, what I'm recommending, every time you wake up at night and get ready, just once, I want you to give teeth a quick brush, and I want you to give them a quick floss just to remove any dead materials. And I want you to do the same right before you lay down in your coffin. All it takes is twice. That's it. As I said, fortunately, you're not going to get any tooth decay. However, make sure to do this, because I want you to be as effective a hunter as possible. All right? And I've got a little baggie here for you that I'm going to leave you that's got some free samples so that you can try out, just from me to you. Now, remember, of course, that you can't see your own reflection in the mirror, so you're going to have to take a little bit of practice to really feel it out. The good news is that brushing and flossing mostly are done by touch anyway, so you're not going to have too much trouble. Now, let's talk about those chompers. Let's talk about your fangs. Now, as you know, your fangs are supernaturally hard and tough and able to tear not just through, of course, human skin, but as I'm sure you've had occasion to do, chainmail, leather armor, weapons, all kinds of things. You could bite right through them because of your supernaturally strong jaws and your supernaturally hardened teeth. That's great. But as you may have experienced, they are not invulnerable. While simple things like steel and leather or car doors are not going to be an object for you, holy items and holy water can damage your teeth. So just like I tell my human patients to ease off on drinking that soda, if you are encountering a hunter, you can bet they're going to have holy water with them or some other blessed object. Now, you're going to have enough hard time fighting them, but you want to avoid at all costs it getting into your mouth because it can damage your teeth. How much harder is it going to be for you to feed if 2 of your teeth have been melted by a blessed sacrament? It's going to go right through like a hot knife through butter. Now, that will eventually heal, but damage from an holy weapon takes longer and is very painful to regrow. If you do have that problem, feel free to come and see me. For a rather large fee, I can fit you out with some temporary ones that you can put in that will bond to the tooth next to them, that will allow you to get the job done. It will allow you to cut through the flesh and drink blood, but you're going to have to remove them anytime you want to have a normal conversation, And of course, you'll have to take them off once your teeth fully regrow. The cure to this, by the way, just like everything else, lots and lots of blood. You're going to need to drink a lot of blood to heal that damage to your teeth. But the good news is, I'm seeing that you are looking great. I'm going to finish your cleaning here. We're going to get you all nice and spiffy. Your breath is going to smell like roses. And then we'll get you out there on the hunt. But remember, I want you to come back and see me in 6 months. I know you won't age, but your teeth still need care. So let's get started on that cleaning. And remember, brush and floss twice a day keeps the vampire hunter away. Let's see, your teeth are looking good, but if you want to look even better, go ahead and subscribe to Roleplay Riot or watch one of the videos that I have. I think you'll enjoy it. And please, watch out for vampires.